So we're under attack. The things that we eat, the things that we do are affecting our bodies, and it's reducing our metabolic health. Let me tell you how this affects your eyes. So the number one metabolic disease is diabetes. Diabetes is a disease of the body in which you have too much sugar in your blood. We have trouble releasing insulin and having it be effective. Now, this affects your whole body. You've heard of things of diabetic neuropathy, diabetic retinopathy, diabetes. Diabetes is the leading cause of blindness in working age individuals, and when we look at our overall population, more and more people are being affected. I want to tell you how specifically diabetes affects your eyes. Alright, so you have diabetes. Your doctor is going to tell you to get a diabetic eye exam. You may ask yourself, what's different in a diabetic eye exam? Well, at my office, we are pretty comprehensive with every single patient. There's things I look for specifically in my diabetic patients. The first thing is their corneal nerves. Now, with diabetes, you've heard of diabetic neuropathy. This is where your nerves are damaged because you have lack of blood flow to areas of your body. We see this in diabetic foot ulcers, but I see it in your corneal sensation. We do something where we actually take a cotton wisp and we put it on your eye and we see how quickly you blink. Believe it or not, diabetic patients don't feel the wisp directly on their eye. This is because their nerves are becoming damaged. When you have a damaged corneal nerve, you produce less tears, you blink less. This can lead to neurotrophic keratitis, which can cause you to have corneal scarring and actually lead to blindness. Now, this can be managed, but I need you to know if you're diabetic, we need to take care of your cornea, take care of your nerves. Number 2, diabetic retinopathy. So diabetes is a disease of the small blood vessels in the body. They get leaky. Well, the smallest blood vessels that you can see are in the eye. Well, when I do a dilated fundus exam, we also take fundus photos. That means we look at the retina, the back of your eye. We can actually see blood vessels and how the diabetes is affecting them. With diabetic patients, I don't care how well you control your blood sugar, the longer you have diabetes, you're going to get some retinopathy. This means you'll have little dot hemorrhages that are affecting your retina. These dot hemorrhages can damage the tissue and cause areas of the retina to die. Again, I know it sounds crazy and scary, but it's something that we can manage. We just have to be proactive about it. In addition, there's something called Diabetic Macular Edema. The macula is the central part of your retina that allows you to see 20/20. Well, when these blood vessels get leaky, the fluid will seep out and make the macula swell. This is why you have vision changes when you're diabetic and your blood sugar is not under control. Another thing that happens when you have high blood sugar in your body, your lens of your eye will swell and shrink. Again, this is another reason why your vision might fluctuate if you have uncontrolled blood sugar. This obviously affects your vision, but it can affect your overall eye health long term. When the tissue is damaged, it will not always heal, so you have to be proactive about getting these exams and keeping that blood sugar under control. Now, if we see damage in the back of the eye, there's things we can do with injections, with steroids to keep the inflammation, keep the swelling down. But again, if you're not getting the exams, time is of the essence. The quicker we act, the more vision we can save. The last two things that I see and I always check for in my diabetic patients are glaucoma and cataracts. These patients are twice as likely to get both. So we want to check your lens of your eye for cataracts. If there's any changes, we can make sure we get you into the hands of a cataract surgeon and they can help remove the cataract, give you your best possible vision. And with diabetes, we're looking at the optic nerve. The cable connects your eye to the back of your brain and allows you to see. We want to be proactive because again, time is of the essence. When it comes to diabetes, we're checking all of this in an exam, but we want to do it as frequently as necessary. If everything's under control, yearly dilated exams are the standard of care. But if we see changes, we might see you as often as every 1 to 3 months. So get in, see your eye doctor, and make sure you're keeping the blood sugar under control so we can keep you seeing for the rest of your life. So if you learned something new, like, subscribe, and we'll see you in the next video.